Welcome to the Art of Listening to Your Body podcast. My name is Jin Ong and I'm your host. I practice as an osteopath and psychosomatic therapist and am fascinated by the mind-body connection and how your physical body is a manifestation of your emotional state. I help people get unstuck from their chronic pain and live the life they want, grounded in values and driven by purpose. My aim is to create awareness to the underlying emotions behind pain, injury, and disease in the body. Join me to learn more about the story of your body, what different issues may indicate, how to release emotions so that you can prevent problems, as well as inspiring pain story interviews. I absolutely love interviewing health and wellness practitioners, and the conversation often goes down so many different directions. And I really had a lot of fun talking to Zahava today, who is an acupuncturist based in Chicago. She specializes in women's health, but also treats men and especially their role in fertility and health as well. And for those of you who might be experiencing menopause, listen in because she's got a couple of tips on foods that you can eat. So you can go to the supermarket and stock your trolleys up and start eating these foods to help you in those menopausal times. There's so much we probably could have gone a lot further into. We talked about the tongue and how your tongue can tell you so much about what's going on in your body. It's a pretty amazing muscle. And we talked a little bit about the Chinese organ clock, emotions, and a few case studies, as well as Zahava's background and what led her towards her journey becoming a super passionate acupuncturist. So let me introduce Zahava, who is the founder of the Chicago Family Acupuncture Clinic. She's an acupuncturist, mother, tea lover, lactation counselor, pop culture enthusiast, and a passionate wellness educator. And you can definitely hear that come out in today's chat. As an advocate of women's health and reproductive wellness, Zahava has focused her studies in treating fertility, pregnancy, menopause, polycystic ovarian syndrome, endometriosis, migraines, thyroid disorders, depression, and anxiety for women. She's also a certified lactation counsellor through the Healthy Children Project to help her patients navigate the world of breastfeeding. She's a Doctor of Acupuncture, certified by the National Certification Commission for Acupuncture and Oriental Medicine. She received her Masters of Science in Acupuncture and her doctorate from Pacific College of Oriental Medicine. She's trained extensively in the balance method, a style of acupuncture known for its quick and effective techniques in treating chronic musculoskeletal pain. Her goal is to support, educate, and empower women throughout all stages of life. Welcome to the podcast, Zahava. Thank you so much for joining me.
Thank you for having me.
So tell me a little bit about yourself and what you do.
So I'm an acupuncturist in Chicago. I was born in New Jersey and lived in New York for a long time. Met my husband there, moved to Chicago. I have two children, almost 5-year-old and a 2-year-old. So I'm pretty busy with them. And in 2018, I started my own acupuncture practice called Chicago Family Acupuncture. We specialize in chronic pain and in women's health. And our goal, we see men and women, but our goal is really, and our mission is to help women through all their life transitions so that they can move, smoothly and gracefully through life and transition from puberty through menopause, healthily and happily.
Awesome. And so why is that area an area of interest and passion for you?
I feel like it's hard to be a woman. I think women are incredible. I think that we carry a lot for the people around us, especially as a woman who might want to be a mother or is a mother. We're really caretakers. And as far as women's rights have come, I feel like we still have a long way to go. And there are so many expectations on us, from working full time and then still being primary, caregivers in our homes, responsible for cooking and cleaning. Even though I have a husband who helps with everything, I still feel this tremendous pressure. And so I just think womanhood is hard. And I often feel like, I want my mommy, it's like I want someone to take care of me and comfort me. And so it was important for me to build a practice where women can come and feel like we're taking care of you. So this is a place you can come to that is safe, where you can just be yourself, be your worst self too, and complain as much as you need to. And we can hold a healing space for you, just to give you space and feel the way you feel, but help support you, because we go through so many, flexes hormonally, emotionally throughout our month, our day, our year. And I think it's really, I feel so strongly to just help women, be the best versions of themselves so that they can then be the best mothers or wives or, members of their communities. So I'm very passionate, yes, about helping women.
Amazing. Oh, we can definitely hear it. And I wish you were here in Wanaka and not in Chicago. I love that you say it's just creating that space for you to be your best self and your worst self, and just to let go with the emotions and whatever needs to come up, and have that whinge, because sometimes we just need to verbalize and say the crap, and that's enough to make you feel better and to not be judged in that space.
Yeah, I feel like we all struggle. And, especially now in times of social media where we're all we have to present ourselves a certain way, especially maybe in the wellness community, we might be a little more guilty of, for our businesses and our practices trying to show like, oh, this is a healthy lifestyle, this is wellness. But to me, wellness is so much more than, diet or exercise. It's about embracing that, the suckage of life too, like living in the griminess a little bit and having a hard time and still being able to live your authentic self. That's, to me, wellness. And so it's not just this, pretty Instagram picture.
Yes, absolutely. And that's why I love bringing people like you on board to talk about, you're a mum of two, you've got a business, you love what you do, but what is the backstory to that, which we'll get into a little bit later. So you've got 2 kids and you own a business. How do you manage that?
I don't manage it very well. Because as soon as I find that I get in a flow, something else in life happens. And so I feel like life is full of, chaos and dishes and laundry. And so to me, it's not about having this like balance that everyone talks about in Chinese medicine, which is, what I practice. We talk a lot about yin and yang and those principles. That's like a philosophy of life, but yin and yang is dynamic and always changing. And so it's not about just like, managing as like a mom and a wife and a business owner, but it's like throughout the day or, from week to week, it's always going to look different. And so to me, managing is like dropping the ball all the time. Like, so I find that I can't be a present mother and have a clean house. So I don't have that expectation for myself because I just know for me, that's not possible. So I'll let go of the housework and I'll go to sleep with dirty dishes so that I can be a more present parent. So that's how I manage. And that's really the truth, is that I don't aim for the perfection of it. I just let things fall to the wayside that aren't as important. And I constantly am reevaluating my values.
Yeah. Yes. Yeah. With new life experiences, it's so important to reevaluate your values. Your house is looking pretty clean. I can see it on the video. Maybe
So what's funny is my husband quickly cleans it for this, and we just threw all of the toys like there.
They're off the screen.
Yeah, and it's a mess, and like and there's like laundry piles, and but I think part of like what I think about with wellness is that I can't do it all, and that's okay, and I need to be kind to myself. and not be hard on myself to like have this perfect life.
Mm.
And that's really how I do it, is I
Yeah.
try to be kind to myself.
Yeah, cool. So well said. All the ups and downs of, yeah, being everything sometimes and not expecting so much of yourself. And I know that I've had to let go of tidiness at times. Sometimes I feel like it's good having my friends over because it makes me clean up a little bit
Yeah.
more. But yeah, letting go of things and just realizing what impact does it actually have on you. And
Yeah.
yeah, do you clean your dishes or do you spend time with your kids?
Yeah, and it's always a decision. Like I feel like I'm always making a choice, you know? Like I can, you know, I can let them watch a movie and then clean, and that's fine too.
Mm.
But I feel like no matter what I'm doing, especially with motherhood, it's really always like a choice I'm making. Like if I'm gonna work, and then my house is gonna be messy. If my house is clean, then I'm ignoring my kids. And
Yeah.
I think that that's really womanhood, and I think that's also just why I feel passionate about women's health, because I think most women don't give themselves the space to feel that way. They
Mm.
constantly feel like everything does have to be perfect, and they have to put a healthy dinner on the table and have the perfect house, and it's too much. And I think that causes like chronic illness and pain later on.
Yes. Yeah, just the ongoing stress, the unnecessary stress and pressure. So have
Yeah.
you always been passionate about women's health or is it just since you had kids?
No, I definitely wasn't always passionate about it. Yeah, I think that as I've experienced life, I'm like, oh my God, this is so hard. And I definitely like going through these experiences myself of motherhood and yeah, becoming a business owner. It was like this rude awakening of like, wow, if I'm struggling and I'm a pretty together person, I can't imagine how other people are feeling. And also, why is nobody talking about this too? You know, when I get
Mm.
together with friends, they make fun of me because I'm always asking questions like, oh, but like, how do you manage? Like, I'm just curious to know how other women are like doing it all or
Yeah.
managing. And it's just something that fascinates me.
Yes. Oh, that's so cool. So tell me a little bit more about the style of acupuncture you do and cover a little bit about traditional Chinese medicine because I think it's fascinating. I pull on elements of Chinese medicine. By no means am I a Chinese medicine practitioner. I grew up with that, but yeah, give me your overview and why you're so passionate about it.
So, acupuncture, yes, it falls under the umbrella of Chinese medicine. Um, Acupuncture is basically working to stimulate the nervous system to help decrease pain and balance out your neurochemicals. There's amazing research that's been coming out in the previous years about the efficacy of acupuncture, and so it's basically helping balance. So as we're talking about how easy it is to go out of balance and feel overwhelmed by life, what's nice about getting acupuncture is it helps kind of harmonize your system, and it really does connect your mind, body, and spirit. Um, I found acupuncture, yes, through my own trauma and pain. Like, and if you talk to any acupuncturist, most of them have too, where we've all kind of felt this weird out of body experience, and acupuncture basically integrates your mind and your body. So it's extremely sedating and relaxing. Most of my patients take a little nap when they're on the table. So we're basically working to just sedate the nervous system and let your body heal itself.
Mm-hmm. Can you explain a bit more about yin and yang?
Sure, yes. So there's a lot of really cool philosophies within Chinese medicine. Yin and yang is a big one, and the concept of qi is another a big one people ask about. Yin and yang, actually, yin means the shape. They basically 2,000 years ago, when they were developing this medicine, they looked at nature to describe what was going on in the body. So the word yin actually just means the shady side of a mountain, and yang means the sunny side of a mountain. And it's just a way to describe the same thing. It's still a mountain, but we're looking at different aspects of the mountain, and you need both. So they're interdependent and they always work together. And within the body, with acupuncture, we have different meridians or channels, and some of them are yin and some of them are yang. So the job of an acupuncturist is to balance yin and yang and create harmony in the body. But yin and yang is not just within Chinese medicine, it's just a huge part of philosophy. And it's like a, a principle that anybody can live by, but it's really trying to have harmony and balance together.
Yes. Oh, that was so well explained. And it's like you can be stressed, and stress is part of our life, but then we need to have that yin or that feminine space or that parasympathetic nervous system to wind us back down. So we have
Yes.
both, and they just need to balance one another out.
Right, because when you look at the yin yang symbol, which is really called the Taiji, it's not even called a yin yang symbol the way we say it. But you'll notice, right, on the black side there's some white, and on the white side there's some black. So there's always good within the bad and always bad within the good. And it's exactly what you're saying is, even in stressful times, like stress can be a good thing. And then also we can tip the scale and be too stressed and raise our cortisol, and it can become a very bad thing. So within everything, there's good and bad. There's nothing that's good in the world. There's nothing that bad is in the world. Everything can be balanced. Everything in its right time and space is good, so to speak.
Yeah. So how do you diagnose people? How do you work out if they're yin or yang? Is it because of the symptoms that they come in with, the way they're sleeping, the words that they use? Do you check their pulse?
Yeah, great question. So we do a few different things. The first one is just looking at the person, observing them, looking at their skin, their complexion, how we kind of look at their eyes, like how much is their spirit alive. So that's one way. Another big way is we do a huge intake. So that's our inquiry section. There's basically 4 pillars of diagnosis in Chinese medicine. So during the inquiry session, we really go over everything, and we take a look at every system in the body. We never separate out one system for another. Whereas in Western medicine, you might have a headache, so you'll go to a neurologist, or you have IBS, so you go to a GI. In Chinese medicine, we're asking questions about everything, and we create what we call is your root pattern diagnosis. So based on the information you tell us, what do we think is the root cause of the symptoms you're experiencing? And then to confirm that diagnostically, we do check both radial pulses, and we look for qualities. Is it fast? Is it slow? Is it deep? Is it superficial? Does it feel slippery? Does it feel wiry? And all these tune us into what's going on internally. And then we do something really cool called tongue diagnosis, where we have people stick out their tongues. And again, the idea is that whatever comes from within your body out tells us information of what's going on internally. So if you urinate and it's extremely yellow, oh, I'm dehydrated. So with our tongue, it's the only muscle in the body that we can externally see. So in Chinese medicine, we'll map out the tongue and all of the organs onto the tongue. And based on the color, the coating, the cracks, the texture, we'll diagnose the person too. And so that is also going to tell us about the yin and yang in the body. So yin represents fluids in the body. So whether that's blood, it can be like humor, it could be cerebral spinal fluid is yin. And so often with a woman who maybe is going through menopause, we start to see their yin decline. And so in the tongue, they might have a lot of horizontal cracks, and they might have a lot of redness without a tongue coating. And that tells us their yin is declining. So yin represents cold, so that's why they have a surge in heat, hot flashes, night sweats. So that's kind of a way to explain also how yin and yang works within the body too.
That's amazing. And I love the tongue diagnosis. I know that when I'm not feeling great, my breath changes and the look of my tongue changes. And so what does an ideal tongue look like?
Oh, good question. An ideal tongue is, light red, not too pale, not too dark. And there, in an ideal tongue, there wouldn't be cracks. There wouldn't be a lot of swelling. So sometimes, let's say a thinner person could stick out their tongue, and you're like, "Whoa, that it looks so big." So that's a swollen tongue. So that will show something. And um, so yeah, so you kind of want it to have, no tongues, like a light pale pink, just a nice shape to it. It doesn't quiver too much. It doesn't move too much. It's not too stiff. So it has a lot to do with the movement, the coloring. It has a nice thin white coat. So not a yellow coat, not like a thick white coat, not a peeled coat. That's really what a good tongue looks like. I do see good tongues, but most people, have interesting tongues. And the goal with acupuncture is every few sessions, we'll take a picture and we'll see the tongue change with their acupuncture treatment. So it's like a marker for us to know that we're having success with our treatments.
Yes, amazing. So everyone needs to go and look at their tongue, and your conventional doctor probably wouldn't have anything to say, but a TCM or Chinese medicine practitioner can interpret what's going on a deeper level and actually help you prevent the issues that might be stewing and brewing under there. But
Yeah, that's a
it's
great
incredible what the
point.
tongue can tell you.
Yeah, that it really is a preventative tool. Like Chinese medicine is designed to be preventative medicine. Most people, when they come to us, are already in pain or crisis. But what's so cool with the tongue, we can see like if somebody has big sublingual veins, like dark distended veins under the tongue. For a woman, we can say, oh, like, are you getting your period? So there's so much that we can tell. And it is great to kind of look at your constitution and say, these are things you might be prone to later on in life, even if you're not feeling that way now, based on your tongue. So it is such an amazing tool.
Oh, absolutely. And what you said about constitution and environment, because my issue is my liver, and I have problems with damp and heat. And
Mm-hmm.
so that was my turning point when I lived in Brisbane, which is really hot and humid.
Mm-hmm.
After about a month, my body couldn't tolerate it anymore. And that was the unhealthiest I had ever experienced been. I was getting all sorts of crazy symptoms, and it was the environment that was just too much for my constitution. So I now know I can go on holidays to places like that, but I cannot live and I cannot work there. So I live in a more temperate climate now here in Wanaka, and it's way drier, and I love it.
Yeah.
And my liver
Yes,
loves it.
that's a big part of Chinese medicine is external environment. And so basically, again, they would look at nature and then describe the body. So our medical jargon in Chinese medicine is very strange to people, because we'll describe a constitution or somebody as being dry, damp, hot, cold. And it does sound so strange. But it's true. Like, people get sick in certain climates and environments. And damp heat for a woman might look like chronic yeast infections, as an example. Digestive disturbances is another example. A damp heat tongue is going to look red with a thick yellow coating on it usually. So it's not fun to experience being damp heat, so to speak,
Yeah.
in the world of Chinese medicine. It's not a fun diagnosis to have. And environment can help clear it. It's really, and it's cool because China is such a big country. So when they developed it, they saw that people that lived in the north of China they would get more like colds and flus, and people who lived in southern China would have more of the damp and the heat. So environment is really a huge factor in how how your health is, really.
Yeah. And your environment can dictate your diet as well. So I know there's a lot of people who are like, oh, raw food diet. And I knew that I could eat raw food more in a hot environment, but here there's no way I could digest a solely raw food diet. And that's where China is really good, because of all the different climates and environments. And you see the different type of food they eat in those different areas. They eat to their environment and their seasons.
Right. Yeah. So in a lot of damp heat environments, they're eating certain damp foods like bananas or pineapple. So again, like, your constitution gets used to certain foods, but we'll often tell people, like when with women, for example, in my menopause example, when their yin starts to decline, we'll say, oh, eat very yin rich foods like cucumbers, pears, more iron rich foods. But it's true, yes. So what's cool is with Chinese medicine, it's very personalized. There's no one diet, no one size fits all. It's everything is based on your specific constitution. So even if you had damp heat, I can treat 10 different people with damp heat and give them different acupuncture treatments. And same with, if I have 10 people with migraines, they're going to have different constitutions. They're also going to get different treatments and different, dietary recommendations. So yes, environment plays a major factor. Can I tell you a really cool story, actually?
Yeah, go for it.
Because it speaks so well to environment and what we're talking about, but I just had a really interesting case where I had a woman come to me and she starts explaining to me she has terrible ear pain and she's been to every doctor. Nobody knows, all her tests are coming back normal. Nobody knows why she's having all this pain in her ears. And she's telling me how she was on a walk and it was like a nice sunny day in the spring. And all of a sudden a cold gust of wind came and like if she felt like it like smacked her in the ear. And since then she's had ear pain. And this started like in April. So I'm like, oh, that's so easy to treat. Because in Chinese medicine, we call that wind cold, which again, it sounds kind of, silly, but it's literally a cold gust of wind came in externally and got trapped in your body. And there's acupuncture points for that. And it's, in a few treatments, you'll be fine. And she was like amazed, like, oh my God, everyone else thinks I'm crazy when I'm telling them, I don't know other doctor cares that I was on a walk and that it was like a windy day, But I'm like, oh no, we care.
Yes, it's listening to the story. And yeah, for her to just go, it was the wind and it hitting my ear. That's really cool.
Yeah.
So her ear pain is gone?
Yeah, so we're working on it. We've done a few treatments and she's improving already. And she's so thrilled. But she's such a great candidate for this type of medicine. So I'm excited to see her because I feel really confident that we can treat this. And, she's been in pain for so many months and has been to like every type of specialist. So, but it's something so simple as like, it was, wind cold trapped in your ear. And that might sound really simplistic, but that is a Chinese medical diagnosis.
Yeah. Yes. Oh, I love it. What are some other common conditions that you might be able to share with us? You talked a little bit about menopause, and I'm sure the menopausal women will really appreciate that, and they'll go stock up on cucumbers and pears now. I know I talk a lot about the liver and the emotion of the liver being anger.
Yes.
Is there anything around that?
Oh my gosh. So the liver is a major yin, considered a yin organ. Yin organs in Chinese medicine store. So so the liver storing blood. The liver is, the emotion of liver is anger. So a very common pattern, what we would see in Chinese medicine is something called liver blood deficiency. That's very common in women. And it doesn't necessarily mean your liver isn't working or your blood, it doesn't necessarily mean that you're anemic, but a common pattern for that would be a woman who might have floaters, dry skin, PMS, stress, irritability. Those are really common liver blood deficiency signs, and they'll also kind of have fatigue. Another liver one that we see all the time is liver qi stagnation, and that's the typical person who is extremely stressed and again has menstrual irregularities. So usually in Chinese medicine, when we're looking at the liver, we're looking at gynecology, and we're seeing what's awry here, and we'll ask questions about menstruation that, again, your doctors won't ask. We care, do you have clotting in your menstrual blood? That's going to show if there's liver blood stasis versus if your menstrual blood is light red, that's more liver blood deficiency. But if it's dark purple, that's more like liver blood stasis. So we're diagnosing all these liver conditions based on the details of someone's menstruation, or like how long or short your cycle is. Also will tell us how's the blood moving in the liver system. But liver is something, there's probably not a treatment where I don't do liver acupuncture points, because most people that are coming into our clinic have stress and anxiety. And so we want to soothe the liver chi, is what we say. The liver is responsible for the smooth flow of chi in the body. That's the liver's job. And so if the liver's overwhelmed, then it can't do that. And then if there's also a lot of pain in the body, there's there's no smooth flow of chi. And so the goal of acupuncture is to help the liver move all of that chi.
Yes.
So the liver's a huge, it's an extremely important organ. But when you say that you have issues in the liver, I'm curious to know, would you share what you find is livery about you?
Oh, yeah, for sure. So I can definitely relate to anger, especially as a teenager. I was really explosive with my anger. And
Mhm.
then also, I can see my emotional tendency is to get irritated, to get frustrated, and still on occasion have those angry outbursts. And it comes back to, I had a lot of skin issues when I was a teenager, and I was
Yes.
only, yeah, so yeah, the skin manifesting with acne, which was anger and irritation, frustration on an emotional level as well. And
Yeah.
that's where my health issues really flared up in that hot, humid environment in Brisbane. My skin just went crazy, and it made me look internal into my emotional state. But also, the other thing that happened was, as a teen, I only knew really conventional medicine ways. I didn't know about naturopathy or Chinese medicine, and how it might be able to help me. And so I did end up on the pill, which isn't great for your liver. And I also ended up on Roaccutane, which was that synthetic
Mhm.
vitamin A, which you have to get blood tests to check that your liver's actually coping with it. So
Yeah.
I just like bombarded my liver on a physiological level with these hormones, these synthetic products, and I feel like I had to do a lot of repair work. So I actually went down the herbal medicine naturopathy route. I did have a little bit of Chinese medicine acupuncture as well. And I had to look at my emotional state. I had to acknowledge that, because I was constantly being told you've got a damp, hot liver and there's
Yeah.
anger. And I was like, great, what do I do about it? So that's how it's manifested. I feel like my liver is a lot happier now, though I don't have
Yeah.
issues like I used to.
That's great. Yeah, the liver, we say a healthy liver person, like, because some people are just, we call them livery people,
Mm.
who tend towards the emotion of anger, irritability, frustration. A healthy one is like a tree that has roots firmly planted in the ground, but can be flexible and sway with the wind. Whereas an unhealthy liver person is a bamboo shoot that's just shooting straight from the ground up and is not flexible and does not move and is rigid. And that's what we call like a wood personality. So we have
Mm.
the 5 elements in Chinese medicine, and liver and the liver and gallbladder are wood organs. And so a lot of liver people can be type A, they're organized, and liver people make really great leaders. So they have so many great qualities, but when they're not in their healthy states, like, boy, watch out,
Mm.
and steer clear.
Yes, absolutely. I can resonate with that. And I've had to learn with business to become more flexible, and with staff as well. The biggest thing I had to let go of is that not everyone is going to treat like me, but actually they're their own person. So that was a good
Yes,
lesson. And maybe that's helped
that's
heal my liver.
That's a huge lesson for someone who's a liver, because they're great managers typically, but can tend to be a little rigid, and a little stubborn maybe. So I
Yeah.
feel like that's like a great exercise. And also, like, things like laughter help massage your liver. So just having fun is good for liver people too.
Cool. Oh, that's awesome. So we haven't even touched on fertility stuff. Maybe we'll just go a little bit into that. And I found it interesting, just as we were chatting before, because America has been, I don't even know how to put it, but the pandemic has hit you guys pretty hard. Just tell me
Yeah.
a little bit about that and what your thoughts were and feelings were towards your fertility patients.
Yeah, so I love treating fertility patients, whether it's someone who's just thinking about getting pregnant or someone who's been struggling for years to start a family. I feel like they really need a lot of space to have their experiences heard, and they need to be cared for. Often people struggling with fertility don't want to share with others what they're going through, and it further can isolate them. So I feel like they really need such attention and care and support, and just like a really safe space without any judgment. And people going through fertility are making a lot of hard decisions. One thing that happens in the US and a lot of states is a lot of the IVF clinics had to close. So in the world of fertility, when you're trying to get pregnant, every day feels like a year. Like time is completely warped, and moves very slowly. And you're always waiting for your next cycle and the next medication you can start. And for that to stop because of a pandemic and stop you trying for a family, I couldn't think of something worse. Like, I just felt so bad for these patients, to be told that, whether they were mid-cycle that they had to stop or they couldn't begin a new one. It's so heartbreaking. So at least, once at my clinic had to close too, which also made me feel even worse. But once we were back open, yeah, we can start seeing our fertility patients again and helping them prep for their, whether it's their IVF cycles or IUI or whatever they're choosing to do.
Cool.
But I think the stress of the pandemic, it only exacerbates their issues, and there's a lot of studies about fertility saying that, stress is a cause. Of course, it's not the only cause at all. It's not like, oh, don't be stressed and you'll get pregnant. I hate when people say that, but it's not going to help. So stress and inflammation is up, and that makes it even more challenging to treat these amazing patients.
Yes. And you do work around implantation as well to help hold the pregnancy.
Yeah, there's a lot of great research about IVF support. So first, we would treat somebody before an egg retrieval. Acupuncture is shown to help increase egg quality, and egg count as well. So there's great research on that. And then for men too, acupuncture really can help with their sperm quality and counts. So it's also important for men to get acupuncture. And then what's really cool is there's great research about the actual embryo transfers. So usually I'll try to treat women 24 hours before and after their embryo transfer. And that's also supposed to help increase their chance of success. A lot of IVF clinics in the US are hiring acupuncturists to be on staff, which is incredible. And such an amazing service for these women, even just to help calm their nerves before the procedure. So, but there's really great studies on it, which is really exciting.
That's awesome. So you stick needles into people when you do acupuncture, but what if someone wants to consult with you because you've just shared such a wealth of knowledge about everything today, especially around the women's health aspect? Can you do acupuncture or consults online? Because a lot of people had to go online during the pandemic as well.
Yeah, the pandemic, like closing my business, really had me thinking, oh, how do I do this virtually? Because I don't think anything could replace acupuncture. I'm just so obsessed with acupuncture itself. However, we did start preparing because a part of us thinks we might have to close again in the winter. So we are starting to prep. How do we bring wellness virtually to people? So it might look like running classes, but we do telehealth consults. So one of the things we're working on is doing these wellness consults online where somebody can come to me and tell me their signs and symptoms. And we do a whole Chinese medical intake. And I could look at their tongue on the screen and ask as many questions as I need to. And I can come up with their Chinese medical diagnosis. And based on that, create a whole individualized plan for the person on dietary recommendations, supplement recommendations, and general lifestyle recommendations. Because if you're struggling with, you have too little yin, or you're struggling because your yang is like through the roof, even just your general wellness advice is going to look different. So yes, so we are going to be doing telehealth visits. You can actually sign up now on my website for them. I do them on Fridays. But it's something that we're trying to like kind of pan out more of, because we think that will be like a greater need as the flu season starts and people get nervous to come into the clinic.
Yeah. Oh, that's great. And because can you tell people acupressure points that they can use on themselves as well?
Oh, definitely. Yeah. Acupressure and self-massage is an incredible tool that people can do at home. I really try to like train all my patients to take care of themselves at home. So I'm always trying to give them as many tools as possible so that they can continue the work on their own. So I'll teach them different skills, like I'll teach them how to do gua sha or cupping, so that they can do that at home as part of their self-care. And yeah, acupressure is a huge one. I always am getting phone calls about labor induction, like what are the acupressure points for labor? So I made a YouTube video for my patients for that, because I kept on like writing the same thing. Yeah, acupressure is amazing. And I really believe that doing anything that's you doing self-care is extremely healing and is going to help you. So even though I prefer for you to come to my clinic and get acupuncture, doing acupressure is healing and will help.
Yeah. Oh, that's amazing. And also you doing it on Fridays is great because it's Saturday here for people. So yeah, a lot of our clinics aren't open on the weekends here. That's really cool. I haven't even gotten into your backstory. So let's get into that. How did you get into acupuncture, or where were you with your health before all of this?
So I will say, since childhood, I've had what we say is a weaker constitution. You're born with your DNA and you're born with who you are. So we call this in Chinese medicine your Jing, your essence. So you have your prenatal Jing, which is what you're born with, what's given to you. And then your postnatal Jing is environment and lifestyle factors. And so I do believe I was born with just a weaker Jing. Like I always had chronic ear infections as a kid and was always on antibiotics, like just one of those kids. And then in my early 20s, I got into a relationship that ended up being horribly abusive and just emotionally and physically. And it was just the first major trauma in my life. And I felt like a bus hit me. Like I just didn't have the coping skills to deal with such a life situation, although I don't know who does until it happens to you. But, I was pretty young. And after I got out of this relationship, which I'm so happy I did, I was just so ill. I was so sick. I had chronic bronchitis. I had strep throat all the time. I was getting skin infections, just really weird symptoms and stuff, just a lot of pain. Recently, a friend of mine sent me a picture of myself from like 2010, and I was sneezing, holding a bag of pills. And it was like a whole joke that like that's what I looked like then. And I wasn't like looking at it now, it's shocking to me because I really like rarely take medication. But I was like, oh my gosh, that's what I was like. I was just living off of like Sudafed and like whatever would come, whatever cold I had. And so I was really just a mess. And I was also, of course, not eating, so completely malnourished, not sleeping. And then I would go to the doctor and they would put me on Lexapro and Xanax and every like antidepressant, anti-anxiety. And they just like, oh, it's going to help you sleep. And, so my whole body just seems like it was falling apart. And even though emotionally I was in therapy, I was taking steps to try to get better, physically my body just couldn't catch up. It was like there was just so much trauma and damage done that my body was holding. And one time I got really lucky that a friend of mine was just mentioning that she went for acupuncture. And the way that she described it kind of hooked me. She said, oh, I went to this acupuncturist because I had so many health issues. Like I had headaches and IBS, and then like I had foot pain. And when I went to the acupuncturist, she told me that it's all connected. And she said it's like all on the same channel. And that's why I have it. And like in just a few sessions, I'll be better. And like she was. So that's kind of amazed me. I'm like, oh, wow. Like, because I have so many problems. Like I'm not sleeping, I'm not eating, I'm having panic attacks. I'm like coughing up my lungs, like so sick with bronchitis all the time. So I was just kind of like amazed at the prospect that like somebody might have a solution to kind of treat it all together.
Yeah.
And when I went to the acupuncturist, she was like, oh my gosh, yes. Like it was the first time in my life where I really saw my mind and body and soul are connected and they're one thing. And there is no separation between any of them. It was like such an eye-opening experience. And through acupuncture, I've never had bronchitis again. Of course, it healed me. But the impact that it had with me doing, even just cognitive behavioral therapy and acupuncture, it was like such a powerful combination of like really like working on getting rid of the stagnation in my body and all of this trauma that I was holding on to. And it really allowed me to heal. And once I got acupuncture, I just knew, okay, this is my life. Like I'm done. This is my mission. And I haven't really looked back since.
Wow. So what did you do before acupuncture then?
I was kind of like never knew what I wanted to do type of person. What's funny is I always knew I wanted to do something different with my life. Like I always knew like I was going to do something that's like not typical. I guess that's more my personality. And so I worked at like some random jobs. Like I worked in a school for a few years. I wasn't doing anything that I felt passionate about. And even actually right before my introduction to acupuncture, during this like tumultuous time in my life, I started going for massage therapy. And massage was also so healing. I always say people don't give it enough credit. After being through some physical abuse, to reintroduce touch in a way that's safe and healing was extremely helpful to me. And so first I actually did go to school for massage therapy because I just wanted to do something healing that would help people. And that was kind of like, I didn't want to sit at a desk. And, once I went to school for massage, I went straight into acupuncture without a break. So it was about, in the US, becoming an acupuncturist is 4 years, and then a 5th year for if you get your doctorate. So I was in school for many years, which is why I worked for a short time and then was a student for a really long time.
Oh, good work getting through all of that. And yeah, so you're so passionate about it. So it's cool that you found acupuncture and that you can express yourself in that way. What was the Chinese medicine interpretation of you getting bronchitis and not eating and those manifestations?
I love that question so much because I see this a lot with my patients. I have this belief that symptoms of the throat, because I was also getting a lot of strep throat, is your throat is what connects your mind and your body. And so when there's a disconnect happening, you'll have symptoms in the throat. And I'll see it even today. Like I had a few weeks ago, I was like really stressed and I like got a bad sore throat right away, So I often find that for me, at least, it's when I have things to express that I'm not expressing, I will stagnate in my throat and get those types of symptoms. And so in Chinese medicine, a cough we call rebellious qi. It's like your lungs are rebelling against you. And I feel like sometimes we do that to ourselves where we might have things to express, but maybe it's because we're women or, we don't want to hurt anyone's feelings. At the time when I was this sick, I had a lot to say that I couldn't. I was really upset about the life situation that I was in. And I internalized it all and blamed myself. And there were things that, let's say, I wanted to say to my ex that I couldn't say to him. He wasn't in my life anymore. And there was this, no closure, or there was no talking to this person. And that bothered me for a really long time. And I would just get trapped in the throat. So I feel like that was totally mind body disconnect. Until this day, if I am not connected to my body, I will get symptoms in the throat right away. I'll start to feel like itchy or sore. So yeah, that's more my opinion than Chinese medicine's opinion, but I think Chinese medicine would agree with that too. It's like a stagnation of qi pretty much.
Yes, oh, absolutely. I agree with it as well, because my big thing is about how your emotions manifest in your physical body. And if you look at the chakra system from Ayurveda, it is the throat chakra, which is all about communication and speaking up. So whenever I've got someone coming in with throaty type stuff or jaw discomfort and chest, I say, is there anyone that you need to speak to where perhaps you're not saying what you really want to say to them, or you're just going into freeze mode in the argument, and then you think of all the things that you want to say and you're just mulling it over in your head. And for me, on the psychosomatic level or emotional anatomy, the chest is about that heart space. So the feeling of love, wanting to give and receive love, which perhaps you didn't feel that in an abusive relationship.
Mm-hmm.
But then also the lungs or the bronchitis is that sense of being overpowered by other people.
Yes. And yeah, it's not having that voice.
Yeah.
Yes. I
so
believe that. Yeah. Oh my gosh, it's really amazing. Often like people come in, they're like, I'm so stressed. My first question is always, but where? Where are you feeling it in your body? Like, is it in your jaw? Is it in your chest? Because that's going to change my treatment. And it really does matter. Like, where we all have holding patterns where we tend to like hold our emotions somewhere. But, for some people it's in the shoulder, some people it's in the low back. But that's important information. Yeah.
Oh, it so is. It's all about the location. I know that sometimes when people talk about different pain in the body, and what does that mean? I'm like, well, actually, it's the location that's really important, and how is it presenting? So give me all the details. Or I know people often ask about cancer, and I know that this is a sensitive topic, but I'm like, it's not so much the cancer, it's where in your body, what side of your body, what organ is it affecting, and where has it spread to? And therefore, let's look at the structures that are affected and the emotions behind them, rather than focusing on the cancer.
Yes. And in Chinese medicine, every organ has an emotion. So the lungs are grief. And so again, it's mourning, like having these, lung issues can be like mourning and grieving over what happens. Like, I'm so upset that this happened to me and that I was in this situation, and that it took years of me having grief about this. So I also think, looking at, and it's funny because I didn't have the liver signs and symptoms. Like, I didn't go to the anger. I went to more sadness and grief. Yeah.
Yeah. And your sleep was affected. So there's the Chinese organ clock as well. So were you just having crappy sleep all night, or were you waking up at the lung time?
So I believe that at that time I couldn't enter sleep, but once I was sleeping, I could sleep. So in Chinese medicine, that's a sign of heart imbalance, so emotional disturbance. So that makes a lot of sense. But yeah, the lung time in the Chinese clock is 3 to 5 a.m. I don't remember if at that time I was waking up then. But I know I definitely couldn't enter sleep. Sometimes that's also the spleen in Chinese medicine, where the spleen is responsible for worry and overthinking. So that's also, I was definitely deficient there. And so also probably that in combination with like all of this heart, heart emotional, stuff going on, I really couldn't like fall asleep. And their solution was to drug me, which is like, it's so interesting now because of my philosophies have changed so much. But it's interesting to me that I would go to a doctor and tell them these things, and their solution is to just drug me out of my misery. It's just such a Band-Aid over the problem. Yeah. And I think what I love with Chinese medicine is we're not looking to Band-Aid over anything. We're looking to solve the root cause of the problem. So once I started getting acupuncture, I started sleeping, put it that way.
Yeah, amazing. And that's what I love, how you talked about your friend with her headaches, her IBS, and her foot pain. And one person might go and see the neurologist or the doctor for their headache, and then they'll go and see the gut person for the stomach issues, and then go see the podiatrist for the foot pain. And they might get partially better, but not fully better. And actually, you can go and see one holistic therapist who's able to connect the dots and tell you that they're all connected, and often come back to one root thing that needs to be treated. And
Yeah.
sometimes people get caught up in, I want to feel like I'm doing something. So I feel really good going to see 3 different practitioners 3 times a week. And they can actually get really overwhelmed and probably yang themselves out and cause more imbalance. So sometimes it is that stepping back and actually really asking your body, what are you trying to tell me? Or you seek out a therapist who understands. I love all the traditional philosophies out there, and who understands the emotional and the physical level and can read your body for you, basically. And just
Yeah. Yes, I think it's like we need all of it, we need like all the healing modalities. And what's nice is like I do have patients where I will have to like refer first to their Western physician if there's any, red flags or anything. But then once they're in the clear, it's like it's the best feeling for me, because it's when I get to kind of like play and do what I do best, as kind of like explore the medicine with these patients and see them thrive. So yeah, it's really like, I just feel so blessed to be doing this, honestly. Cause it's a lot of fun. And it's like the best feeling in the world to see people actually get better.
Yeah. And I imagine you're quite the same, that when, people have tried so many different things and then they come to you, like I thrive on the challenge of, I'm going to try everything I can to create a shift in this, and to, the satisfaction and the kick out of like, oh my gosh, it worked. And especially when it's not that conventional pathway, but it is good. I agree that sometimes when people have had all of the testing, at least you know that you are definitely in the all clear, because some people can come in with some pretty scary symptoms.
Yeah. Oh my gosh. I've seen such crazy things. I've sent people to the ER before because they were trying to really avoid doctors. And like, that's not the purpose here. Yeah. I feel like a lot of people come to me as their last resort. It's like, oh my God, I've tried everything. I guess I'll try acupuncture. And it's always fun to like have those patients because, and I'm like, you're not insulting me. That's really like where we thrive, is the cases that are just complicated. And it's because we take like, for acupuncture, it's the more information you have about somebody's body, the easier it's going to be to treat them. And so it actually doesn't complicate things. It makes things a little bit easier when they have so many things, because it just leads you, to the diagnosis. Whereas it doesn't really work that way in other modalities. And I find that the Western physicians that refer to me send me almost their most difficult patients that they just don't know what to do with. And they're like, okay, try acupuncture. Yeah. So it is a fun challenge. And I take the responsibility really seriously, but there is something kind of cool about that too, of like, oh, well, like they tried everything, or they've done all the cortisone injections, and now they're doing better after like a session, with like horrendous back pain, just one acupuncture session, they're like walking out of the office, So, it's incredible. I still have to like pinch myself. Sometimes I just forget how well the medicine works. And, and it's just like practicing the wisdom of Chinese medicine is like, it's such a privilege. And it amazes me every day. It really does.
Yeah, I remember, because I've done Western medical acupuncture studies, which is just completely different, nowhere near in depth as what you guys do as Chinese medicine acupuncturists. And I have so much respect for those of you who practice this way. But I remember during my training watching a documentary, and in China, Chinese medicine acupuncturists are just part of the hospital system, the medical care system, and also that they do anesthesia with acupuncture. Yeah. And a lot of people will opt for the acupuncture anesthesia for open heart surgery, because either they're not candidates to have surgery because they won't tolerate the anesthesia, or it's actually the affordability as well. The anesthesia
Mm-hmm.
is much more expensive. But imagine that, having open heart surgery under acupuncture anesthetic. And that goes to show you that it is super powerful.
Yeah, anyone can YouTube a video of somebody getting surgery under acupuncture anesthesia. It is incredible. Like you can see a woman giving birth under acupuncture anesthesia, like doing a C-section. You can see, yeah, like brain surgery. Like it's insane, and you go into the hospital in China, and there's an acupuncture division and a Western division, and you can kind of pick and choose, like, what do you want, or
Yeah.
where do you want to recover? An absolutely incredible model of care. And, one thing I always note about China is they have this model where you only pay your acupuncturist when you're well and not when you're sick, because if you're sick, that means they didn't do their job right,
Mhm.
because it's supposed to be preventative. So I just think that's like incredible. And I'm always trying to remind my patients, like, don't wait until you're, in a crisis. Like, this could be part of anybody's general healthcare routine. Even for the healthiest patients I recommend coming whenever the seasons change. Just come in for a tune-up and we'll keep your immune system healthy. But it's great and I get acupuncture regularly too, still. So obviously I'm biased, but I do think it's for everyone. And I think anyone can benefit.
Oh, absolutely. And I think that we're in the society today, and people like you is just trying to change that mindset around prevention, and not fixing things, not waiting until it's broken, because actually long before your body shows symptoms, it's been compensating and it's been working pretty hard. And I think like our clinic has been busier than ever after the pandemic. And I think that COVID was kind of like this big health crisis for everybody to experience, to then
Mm-hmm.
go, what am I doing with my life and how am I looking after myself? So people have had quite a shift in that respect. Hopefully it doesn't have to be something worse than that to make people realize. But I think that's probably the big message is, yeah, don't wait until you get sick, is
Yeah.
use those support systems that are out there and connect with amazing practitioners like yourself.
Yeah. And manage your stress and
Yes.
do
And
what you can do. Yeah.
you talked a little bit about gua sha. Can we just cover that?
Oh, sure. Yeah. So, gua sha, it's really funny. It's become a beauty trend, which it makes me laugh because it's a big part of Chinese medicine for thousands of years. But basically, gua sha means to scrape. That's what it means. And so there's a lot of different types of tools out there. My favorite is a wonton soup spoon, is like how I love to gua sha. But basically, it's to break up stagnation in the body. So a very common thing we'll have is somebody comes into the clinic and they can't move their neck. It's completely stiff. They slept funny. We'll literally take out a gua sha tool and some oil. We like apply the oil to their neck. We literally it's all it is like scraping their neck until it gets pretty bright red. And that's what the sha, so like the gua is the scrape and the sha is what's coming up, like the heat and inflammation that comes through the skin. And pretty much they walk out with full range of motion, even after just one session. It's incredible. What's kind of fun now is they have all sorts of tools made out of jade stones or rose quartz stones, and they do it on people's faces. So there's also a lot of people have heard about the jade rolling. So that's also a big beauty trend. So it's basically taking these tools from Chinese medicine that are made from the natural stone. And I have YouTube videos on this if anyone wants, but there's ways where you can just massage your face, and it actually helps prevent fine lines and wrinkles and increase collagen and lymphatic drainage, and it does all sorts of wonders to the face. So you really do have like a really nice glow after, and doing it regularly really does help your skin and appearance. So it is something that's cosmetic. However, I like to remind people who get obsessed with the cosmetic aspect of it is that it's also used medically. So for migraines and headaches and neck pain and TMJ syndrome. So it's not just about the beauty. And anyway, you're beautiful without it. You don't need it. It's the message I like to give people. But what's cool is in my clinic, we actually made our own sets from 100% rose quartz, and people are loving them because it's just self-care to do at home. Honestly, like that's what it is. That is healing, and that feels good. So yes, you might have less wrinkles, or it might help with your headaches, but just doing something, a tool that you can have at home as part of your bedtime routine is so healing and so important, especially, for women. It's a great way to just end your day. So, but it's funny, the cupping also has become a huge trend now, where people come into the clinic and they want cupping because they've seen like celebrities have those big circular marks. But cupping is really just a great way to move chi and remove stagnation in the body. So cupping could be good for anyone. It's not indicated for everyone, but it's also a great modality that we have.
Brilliant. Wow, you've shared so much with us. Thank you. Where can people find you?
So people can find me on Instagram. We take our Instagram really seriously. We try to put up really good quality content. So that's at the Chi of Z, TheChiofZ. So it's my chi, pretty much. It's giving you my chi. And I have like the most amazing assistant in the world, Gina, who has been doing our content and is just so passionate about women's health. We just did a whole series on foods to eat at different stages of your cycle. So, when you're in your luteal phase, what foods should you eat? It's incredible. So we work really hard on just like creating quality content for women. And then on Facebook, I'm Chicago Family Acupuncture. My website is chicagofamilyacu.com. And anyone can email us too at chicagofamilyacu@gmail.com. So anyone can feel free to reach out to us if they want any health advice or consults. We're coming up with a really exciting new supplement protocol for the winter to help people with immune support. So we made one for adults and one for kids. So we have a lot of really exciting things that we're working on.
Amazing. You're creating so much. That's so cool. I will make sure that I pop all those links into the podcast notes. And thank you so much for sharing all of your knowledge and your own story today, Zahava.
Oh, well, thank you so much for having me. This actually was so much fun to just like talk about, everything I'm so passionate about. This was a great time.
Yes, I loved it as well. And I can just see it like just seeping out of you. It's amazing. Thank you.
Thank you.
Thanks for tuning in to today's Pain Story interview on the Art of Listening to Your Body podcast. Anything shared during this episode is for information only. It does not replace professional advice from a healthcare practitioner. If you are experiencing pain, injury, or illness, seek advice that is catered to your individual needs. Thanks for learning with me on the Art of Listening to Your Body podcast. If you like what you've heard, I would love if you could rate, review, and share with your friends. You can find me on Facebook and Instagram. My handle is The Art of Listening to Your Body. You can join my free Facebook group where I go live regularly to teach you about different conditions and the deeper underlying emotions at play.